Hi, my name is Frank Romano. I was born and raised in Pittsburgh, PA, and I now reside with my family in Jacksonville, North Carolina. I am a veteran, having served in the United States Marine Corps, and I am currently employed as a National Field Service Manager by an agricultural technology company called AGI. Did you know that there are over 19 million veterans living in the United States today? Now, what would you think if I told you that according to the Veterans Health Administration, only 60% of those veterans are eligible for VA healthcare benefits, and only 47% of those actually use the healthcare services. According to the Federal News Network, between 2019 and 2020, the average wait time for a veteran to see a healthcare provider from the time they requested it was 41.9 days. And with the cost of most things, namely healthcare, on the rise, those numbers will continue to climb. Veteran wait times for primary or mental health care are unacceptably too long. According to the Veteran Suicide Prevention Annual Report in 2021, this directly correlates with the number of veteran suicides in 2019, which topped off at a saddening 6,261 veterans. My intentions are to present you with factual problems that current United States veterans face and some suggested solutions to reduce healthcare wait times and veteran suicide rates. Over 28% of all veterans have self-reported mental health issues, and 12% of those reported to also suffer from PTSD. If these are the self-reported numbers, it frightens me to imagine what the real statistics are. The main problem continues to be the veteran healthcare wait times for primary healthcare. They're just too long and completely unacceptable. Again, as stated by the Federal News Network in 2019, the average wait time was 41.9 days to see a healthcare provider, and these times are not decreasing. The VA is unintentionally causing potential harm by not seeing patients in a timely manner. When a person reports a healthcare issue and cannot be seen, the risk for healthcare-related problems not being cured dramatically increases. The longer the person waits, the less chance they have of being treated for a cure. As stated by Kraus in 2019 in an article from disabledveterans.org, veterans are still waiting over 7 days to see a mental health care provider from the time of the requested appointment. Physical health care is one thing. Not being able to be treated for a cry out for mental health is another, and it cannot be ignored. To solidify this point, 6,261 veterans that suffered from PTSD sadly took their own life. If we focus on the problem of the 7-day wait time for mental health care, one can directly correlate this with the number of veterans that commit suicide each year. How many of these lives could have been prevented? Here are some suggestions and action points to help reduce the wait time for veteran health care, offer more veterans the ability to have VA insurance, and reduce the number of veteran suicides. We can prevent health care to all U.S. veterans who have served honorably and reduce wait times for primary and mental health care issues. We can expand the VA health care benefits to all veterans to be able to see local or private health care providers. We can ensure that any mental health cry for help is addressed and the patient is seen within the first 24 hours. We can focus on programs that assist all veterans in the transition from veteran, military to civilian life. We can address the VA healthcare budget. According to the Center of American Progress, if more veterans are given access to VA or privatized healthcare, they have a better opportunity of receiving help they required. Also, shortened mental health care wait times would reduce veteran suicide by presenting them with the help they require. As stated by VA.gov, as with all government implemented programs, Funding must come from taxpayer dollars. The government allots the funds that the VA receives from the federal budget each year. We must do our part to make sure that the majority of these funds actually get allotted to the VA. What can we personally do to help? Each one of us can be involved by writing their local, state, congressional member or their Senate member. You can find out how to locate your representative by visiting house.gov/representatives. After hearing the information presented, do you agree that the time for providing all veterans with the health care they earned or they deserve is now? In conclusion, in 2020, the wait time for a veteran to seek primary health care was 49.1 days, and an average of 20 veterans per day took their own lives. With only 60% of U.S. veterans eligible for health care and 47% of the veterans actually using the health care, the wait times and suicide rates are not going to drop without a significant push from all of us to encourage Congress and the federal government to act promptly. Let me ask you a question. Do any of you know a veteran that have waited too long to be seen by a doctor or a mental health care specialist? If so, what was the outcome? Let us all do our part to prevent extended health care wait times and stop heartbreaking veteran suicides for all veterans who have selflessly signed their name on the dotted line to defend this country and every one of our freedoms. Thank you.